Welcome to this presentation focused on malnutrition and IBD, hosted by the Crohn's and Colitis Foundation in collaboration with Nutritional Therapy for IBD. We are pleased to partner to offer helpful tips and education for those living with IBD. I'm Catherine Soto, Associate Vice President of Patient Education and Support for the Crohn's and Colitis Foundation, and I'm happy to moderate this conversation on malnutrition. Managing your diet and nutrition is crucial when you have Crohn's disease or ulcerative colitis. It's important to understand how inflammatory bowel disease affects your body's nutrition and how these diseases can impact your body's ability to properly absorb nutrients, which may often lead to deficiencies and malnutrition. Here to discuss this important topic today are two special guests. I'm excited to be joined today by Dr. Stephanie Gold, an assistant professor and nutrition physician specialist at the Icahn School of Medicine at Mount Sinai in New York. I'm also happy to introduce to you Jacqueline Park, a patient advocate and member of the Foundation's National Council of College Leaders. So welcome, Dr. Gold and Jackie.
Thank you.
Thank you so much.
Before we get started, let's just go over a few quick points. The information provided during this presentation is meant for educational purposes only. It should not replace any advice you receive from your gastroenterologist or primary care provider. If you have concerns and questions about your specific care, please reach out to your healthcare provider directly. However, if you have questions that are general in nature about inflammatory bowel disease, you can always contact our IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing info@crohnscolitisfoundation.org. So with that said, let's get started. And my first question is going to be directed at you, Dr. Gold.
Sure.
So tell us, what are the causes of malnutrition in IBD patients and what symptoms are associated with nutrient deficiencies?
Thank you so much. Those are both great questions, and thanks again for having me tonight. So malnutrition is estimated to affect roughly 30% of our IBD patients we see in clinic and almost 70% of those we see in the hospital. And the cause of malnutrition in this population is quite multifactorial. It can include altered gastrointestinal anatomy after surgery, decreased oral intake in patients who are having a lot of GI symptoms, just increased gastrointestinal losses from nausea, vomiting, diarrhea, and loss of an ileostomy output, as well as side effects from medications such as steroids. Can also be caused by malabsorption of nutrients across the intestinal border. And then our IBD patients in general have an increase in their nutritional needs, and especially in those who are flaring. So the nutrient deficiencies that you mentioned could be quite common in patients with malnutrition in IBD. And the symptoms actually of nutrient deficiencies can be quite broad and can actually mimic the symptoms of the underlying IBD itself, which can be somewhat tricky for us. In general, the symptoms of vitamin and mineral deficiencies can include fatigue and weakness. Some patients feel irritable. They have changes in their hair and nails, joints and bone pain, rash, diarrhea, decreased appetite. In children, you can see restricted growth, and you can even see delayed wound healing. So it's really important to identify these early and then intervene with supplements.
Well, that's helpful to know. And what screening tools can be used to diagnose malnutrition? What treatments are available?
Yeah, it's a really interesting question. Thanks for bringing it up. So when we think about screening tools to identify patients who are at risk of becoming malnourished, we need to identify a tool that's easy to use in a busy clinical practice, but also has a high sensitivity for identifying those with malnutrition. So in our practice, we use something called the Malnutrition Universal Screening Tool, or the MUST. And this tool incorporates the BMI of the patient, any history of unintentional weight loss, and then there's an acute illness component that in our clinic, we use the presence of diarrhea or loss of appetite for over 2 weeks. Now, when you think about diagnostic tools, these are actually slightly different than our screening tools. And unfortunately, there are no specific tools for our IBD patients. However, I can tell you in our clinic, we use one of the newer tools. It's a little bit more comprehensive than the other tools available. And this is the GLIM. It's called the Global Leadership Initiative on Malnutrition. And we use this tool because it focuses not only on BMI and unintentional weight loss, but it also looks at muscle health and sarcopenia, which we'll talk a little bit about later, as well as the etiologic criteria of why someone's malnourished, such as ongoing enteric losses, decreased oral intake. And once we identify somebody who is at risk of malnutrition, we need to provide a rapid intervention for these patients. So in my practice, I like to identify what's causing the malnutrition. I think that's really important to identify upfront. Why is this patient malnourished? Did they just have surgery that's removed part of their intestine and they're not absorbing? Or are they having a bad flare and they're not able to eat? So it's really important in order to intervene to know what's causing it. In our practice, we use a lot of oral nutritional supplements to increase calories and protein and nutrition in the diet. So oftentimes our patients tell us that liquid nutrition can be more easily tolerated than solid foods. And then all of our patients get a nutrient deficiency panel when they come in, and this is very patient specific. It's based on that history you take. And then anybody who has any deficiencies will get supplementation, and then we recheck the levels to make sure that they've normalized.
Thank you for that information. And I'm curious to talk to Jackie for a bit here and ask, tell us about your diagnosis journey. And as an IBD patient, how have you been affected by malnutrition?
Yeah, so hi everyone again. My name is Jackie Park, as said before, and I'm an IBD patient. So I have indeterminate colitis, which means I have markers of both UC and Crohn's. I was diagnosed in January of 2020, so it's been about 3.5 years now. Unlike many patients, I had no long-term symptoms. I was completely healthy and fine. And then all of a sudden, I had a quick and sudden onset of many symptoms, including intense abdominal pain, weight loss, blood in my stool, and constant bathroom visits. So I was diagnosed with IBD about 2 weeks after my first symptom appeared, which is also how long it took me to lose about 10 pounds. So one of the first indicators that something was wrong was my weight loss. I'm kind of a smaller person. I'm only 5'4", so my weight's been pretty steady my entire life. And so this rapid loss really concerned my parents, and that kind of was the first indicator something was wrong. So within that first year of my diagnosis, I failed a few rounds of steroids and 2 biologics. So I was kind of going through a lot of the potential fixes really quickly. And so as a result, I couldn't stomach really any food at all. I'd lost about 20 to 30 pounds in that first year, and being so underweight, it impacted me in a few significant ways that I still remember quite vividly. I think the biggest was I was just so exhausted. Movement at all was just made me so tired. I could barely walk up the stairs. My bedroom at my parents' house, it's downstairs. So I basically moved into our upstairs guest bedroom because I couldn't just go up and down those stairs all the time. It was exhausting for me. And I also just lost interest in all my hobbies, all my classes. I was 17 at the time, so I was in my junior year of high school, which is a pretty big year for a lot of high school students, but I just couldn't focus. The only thing I really cared about was food. I was watching food videos and the food channel all the time, like an obsessive amount, just because I think it was the only way that could relax me a little bit since I wasn't eating anything and I was so underweight. And so I think those were the first and biggest indicators that, one, something was wrong that led me to my diagnosis and how I was affected by the malnutrition.
Wow, that's a very moving story you've told there. And I can definitely first saw Dr. Gold nodding in agreement when you were talking about fatigue, because I think that's very, very much something that many IBD patients experience. And I wanted to ask you, how did your healthcare team finally diagnose the malnutrition? How did that come about?
Yeah, so it happened about, I'd say like 9 months to a year into my diagnosis. So like I said, I'd already failed a couple biologics and I was at a pretty low place. I was just pretty drained from like all the emotions and all the, everything that comes from being diagnosed with IBD. So I went in for, a regular visit with my GI. And when they took my initial set of vitals, they noticed my heart rate was extremely high while my blood pressure was extremely low. So they noticed that. And on top of my weight loss, they noticed from my pre-diagnosis weight to my weight now, my GI took those as 3 major signs that I was probably malnourished. So she, brought up that conversation, asked me how my food intake was going. And that led to the discussion that I just wasn't really being able to eat a lot of food. I was struggling with figuring out what I can eat, what diet would allow me to, feel okay while also giving me the calories and the nutrition I needed.
So how did the treatment involve those restrictions you're saying and constant monitoring? Was that part of the discussion with your physician?
Yeah, so at this appointment, they brought in a nutritionist. So I was super lucky. I had a great team and a nutritionist was involved in that. And so they brought her in and we discussed a feeding tube placement. So I was 17 years old when I was diagnosed. I was 17 at this time, and I hadn't really told anyone about my diagnosis yet. It had been less than a year. So I was pretty against the feeding tube. I was still in school. I was really reluctant. My doctor and I, we went back and forth for a while, taking into consideration my own feelings and my desire to kind of find a different approach to getting the calories and everything I needed. So we decided that for now I would try to eat better, and that includes keeping my doctor updated and starting to increase my calorie intake, like focusing on the calorie amount per food item rather than the amount of food itself. So my nutritionist, along with my parents, we came up with a plan. I started to eat a small item, like a piece of toast with like peanut butter or a smoothie, because as Dr. Gold said, liquid diet is always a little easier. And to consume those type of items every like 1 to 2 hours. So I was basically nonstop eating because it's easier to tolerate small amounts of food. I also started on Ensure nutrition shakes, and any nutritional shakes at all. I kind of went through like 3 different brands because they have different flavors. And so those became essentially my lifeline for about a year and a half. Those supplements and then additional vitamins for whatever, I took iron vitamins just because I wasn't taking in enough iron and I was losing so much blood through my stool. Between these different things, I started to have more energy and I was able to like slowly gain my weight back. But I noticed once I started eating that food, I started to feel a little better. I had more energy to put into my recovery and into my, feeding schedule, essentially. I think being being in the depths of the malnutrition is really hard because it's hard to focus on anything else except for that. So I think when you slowly start to integrate these things and these habits into your regular life and kind of allow for that to like grow over time, it became easier to kind of deal with the food aspect of IBD and to start taking in the nutrition I needed.
Thanks so much for sharing that. I think your experience, it's so interesting to hear so many different patients have different experiences, but hearing how you've managed it and how it's been monitored is really important to hear that there's a role to be played here, and a value and an effective partnering with your healthcare team to get everything kind of where it needs to be. So I appreciate that. And Dr. Gold, I'm going to ask you a question that seems obvious, but I think it's worth digging into a little bit here. How does nutrition play a role in treating malnutrition, and how can healthcare providers optimize nutrition for their patients through dietary guidance?
Yeah, no, absolutely. It's a great question. Jackie, thanks for sharing that. It was really a really powerful story. So I think, yes, it is kind of obvious, but it's important to talk about. So nutrition plays a key role in treating malnutrition, but we need to approach it from a multifactorial standpoint. And I do think it also comes back to what I had mentioned before, which was understanding why someone was malnourished. Jackie mentioned not eating as well, not getting in those nutrients, being deficient in iron and those things. So I think it all starts with the healthcare provider taking a good history, asking the patients about their surgical history, how much bowel has been resected, more importantly, how much bowel is left. It's really important to ask. What medications are the patients on? What have they taken in the past? And even a detailed dietary evaluation. I have found that many patients become accustomed to a normal diet. They assume a new normal, essentially. And so when you ask them what they're eating, they may tell you that they're eating a regular normal diet. But if you actually ask what foods they're eating, they may be avoiding fruits and vegetables or high fiber foods. So it's important to ask and actually get a good 24-hour recall, which is what we do in our office. I also think you need to use then that history to gauge what nutritional deficiencies you might have. If someone's having a lot of rectal bleeding, we worry about iron deficiency. If somebody's not eating any fruits and vegetables due to fear of obstruction, we often are checking a vitamin C. So providing that kind of patient-specific nutrient panel is really important. And then it's also important to ask patients when you're going to provide a nutritional therapy or a nutrition support for their malnutrition, what they've heard about dietary recommendations for patients with IBD. There is so much information on the internet and available to patients. Some of it is phenomenal. Some of it is less evidence-based. So I think it's really important just to ask patients where they're at, what they've read, what they know, and to go from there and then to offer nutrition guidance. Oftentimes, as you said, it's small steps of just adding small frequent meals, adding that liquid nutrition in for some extra calories. And once patients start to feel a little bit better, they get a little bit more energy, they feel like they're getting better, you often have a lot of leeway to go ahead and get the nutritional status up.
Well, and Jackie, you shared some of what Dr. Gold just shared about those adjustments. And so you did kind of give us some light into that guidance that you received. Let me shift a little bit my next question in asking, how did you feel after making some of these adjustments? How did that evolve how you felt and how your results and monitoring kind of what it saw over time as you made these adjustments? How did that change?
Yeah, so I think, like I said, I was pretty tired all the time. I was exhausted. I didn't really have, a desire or a want to like continue my hobbies and stuff. So I think the biggest thing I noticed was that I, started to gain that back. I started to get interested in my classes again, started being interested in seeing my friends and figuring out social plans. And I think that was a huge thing that having that nutrition guidance gave me. I think I was also one big thing that my team recommended was a food diary, to keep track of, what I was eating, what my bathroom habits were looking like. And at first I hated the idea of it. It felt really awkward to do that, especially as a teenager. But actually ended up being a super helpful resource that I still use to this day. Like Dr. Gold was saying, sometimes you really don't know what's going to cause a flare or what's going to irritate your stomach. And so I've definitely been using like the trial and error system when introducing new food to the diet. And having this diary essentially allows me to keep track of what has been good or what has, gone well food wise. And it's just been such a nice resource to just keep going back on, especially so far into my journey. I remember at the beginning, it was very easy to remember like what causes pain and what doesn't. But at this point, it's been 3 years. I don't have as good of a memory. So it's good to have that like physical item to look at. And I think a big thing was also hair loss for me. My hair has always been something I've been super attached to. Like I'm the person who cried at a hair salon appointment because it didn't go the way I wanted it to. So I noticed my hair was coming out in like huge chunks, and even my mom was noticing it. And that's always been a super huge insecurity for me. So when, I started taking in the nutrition guidance and eating those 5 to 6 meals a day instead of the 1 to 2 or 2 to 3, I noticed that I was starting to gain a little bit of my hair back. I had a lot of baby hair and like frizz for a while, but I saw it all as good signs that I was getting the nutrition I needed. So I think honestly, the biggest thing I noticed was just how I felt every day was slowly getting better. I was starting to have more energy. I was starting to go out more. I was starting to just be able to focus on stuff outside of food.
I'm very happy to hear that. And I saw Dr. Gold nodding and smiling, and how important it is to keep a food journal if you can. With technology nowadays, it may be a little bit easier to keep track of it. There are a lot of options to kind of digitally keep track of those things. So hopefully it's been easier for your generation to do. Dr. Gold, let me turn this back to you and ask, why is early detection of malnutrition so important? What are some long-term health problems that can result if left untreated?
Absolutely. It's a great point. Thanks for bringing it up. So malnutrition is associated with IBD-related complications independent of disease activity, and therefore we need to address it early. And what that means is that regardless of the IBD course, whether treated or untreated, we actually see malnutrition both in patients with quiescent or disease in remission and patients with active disease. So it's really important that we identify the malnutrition and that we treat it, just as Jackie mentioned. And so just to give you an example, untreated malnutrition can be associated with an increased number of disease flares, impaired response to biologics or other therapies, increased infection rate, and other general postoperative complications in our patients who require surgeries. And so it's really important that we identify this. Now, while this is still a topic that's being further investigated, really we want to help clearly delineate the impact of malnutrition in our patient population. There have been some really interesting studies that have shown this. And for an example, a recent study from the UK showed that patients with Crohn's disease who had a zinc deficiency were significantly more likely to require surgery and to need treatment with steroids. And in contrast, patients with ulcerative colitis who had a selenium deficiency were significantly more likely to have increased numbers of disease flares compared to patients who did not have these deficiencies. And so it is definitely, malnutrition is super important in identifying that to prevent these long-term disease complications.
And how can patients and clinicians monitor treatment progress for malnutrition, and what lab work is recommended?
Yeah, so Jackie mentioned a little bit of that monitoring that was happening with her, but it's a really good, important question. So when we define the type of malnutrition, that will help us define how we monitor it. So for patients who are underweight or who have lost a lot of weight, monitoring the weight and the BMI can be very helpful. And even in patients who are obese, this can also be a helpful technique. So while we often think of undernutrition as classic malnutrition, we have to remember that obesity can be a disease of over calories, so too many calories, but they can actually still be very malnourished. And so we don't want to forget about our obese patient population. In patients with micronutrient deficiencies, we follow the lab testing, as I mentioned, with their supplementation. And so our recommendation in our practice is to get a lab panel of nutrients based on the patient history at the time of diagnosis, and then routinely thereafter. So usually that means about once a year. And these labs are based on the patient history. So if you've had an ileal resection, we may get a B12 level, versus if you're having oral lesions, we get a zinc and an iron. So all of these things are based on the clinical history and the presentation at the visit. And then finally, in our patients, we talked a little bit about muscle loss as part of the new definition of malnutrition, but we understand that if we don't get a good enough nutrition, we're going to burn through muscle. And that's really important to prevent in IBD. And so for patients where we do identify sarcopenia, which is prevent muscle loss or function, we monitor muscle function with grip strength testing in our office. So we have a digital handheld dynamometer, patients squeeze it and we see how strong their grip strength is. And we can actually measure muscle quantity with bioelectrical impedance. This is a scale patients can stand on, and it gives them after 60 seconds their body composition. And we also use other imaging modalities such as ultrasound to get a direct measure of muscle in the office. So we put all of these features together to monitor the malnutrition in hopes that everything is improving.
That's a lot of wonderful, diverse tools to be able to look and monitor for malnutrition. So I appreciate you sharing that. And I like the point that you mentioned. I think it's important about obesity, not always, the assumption could be the contrary. So I appreciate that you brought that up because that is an important point. Well, Jackie, I want to pose the last question to you. You've been through so much in your journey with malnutrition, and I'm so happy to hear that you've come to a better place. And I know the journey goes through ups and downs, as I know you've shared in your story. But what advice would you give to other patients who are at risk for malnutrition?
I think the biggest piece of advice I'd give is to take your time. I think in this world, hustle culture is a big phenomenon, especially in the US, and it can be hard to be a patient with a chronic illness, nonetheless one who's either malnourished or at risk. I think it can feel like you're underachieving or you're not doing enough, but it's really your body just telling you you need to slow down and you need to focus on me right now. It's a long process to get the nutrition back and to get those calories up, especially when you're in the midst of a flare. And so I think it's important to remember that to take this time is important, because if you push it off, or if you wait, or if you let other things become your focus, it's just going to get worse. I think it's important to take the time out of your day or out of your, week to focus on the nutrition aspect of it. Are you eating enough of the right foods? Is there something we can do to supplement? Is there something that you need to discuss with your doctor now rather than later? I think it's all about the time aspect. I think when I was at risk for malnutrition and when that became a conversation with my doctor, I'd let it get a little bit on top of me. I kind of let it continue to pile up until it became a little bit too much. And it just became harder to, go through that recovery process. I think if I'd taken the time out of my day then, or out of my week then, I would have been able to get on top of it faster, and I would have felt better quicker. So I think one is just taking your time, and two, it's remembering, your body, taking in mind your body and what your doctors are saying. It's all connected. And I think it's important for IBD patients to be aware of this connection, of the importance of listening to yourself, listening to your doctors, taking the time. I just think it's really hard to do so, especially in college or when you're in the workforce, to take that time for yourself and to focus on your body once again.
That is such sound advice. I can't help but ask Dr. Gold if you have, from your perspective, what advice you have for patients.
Yeah, absolutely. I could not agree more, Jackie. That's fantastic. Just listening to your body. You told us that story of the fatigue where you couldn't even get up and down a flight of stairs. If something has changed and you're noticing that change, let your doctor know. This is also on us. We really should be screening for malnutrition as we do in our clinic at every visit so that we're picking it up before it gets to the point where your heart rate is up and your blood pressure is down. We want to prevent all of those complications. But really listening to your body, watching for changes in the diet. Really thinking to yourself, is this how I was eating a couple of months ago? Has something changed? Am I getting the nutrients I need? And asking. We always ask our patients about diet and they say, no doctor's ever asked me about that before. Or I wish somebody would have brought it up. And I think it's hard. We have such a limited amount of time in our visits and we have so much to talk about that sometimes nutrition gets pushed away. And I can tell you as a nutrition expert, I don't do that, but it's the reality of our visits. And so I encourage patients just to take a moment and say, I have questions about nutrition. I want to know, or how can I get more information? Can you refer me to a dietitian or a nutritionist, or can you help me yourself?
Thank you so much. Thanks to both of you for your candor, the great information, and just the time this evening to talk through us with this very important topic that all patients should be aware of. So thank you so much for taking the time. Well, if you have any questions about malnutrition, please visit the Crohn's and Colitis Foundation's website at crohnscolitisfoundation.org and also Nutritional Therapy for IBD at ntforibd.org. You can also contact the Foundation's IBD Help Center if you have other general questions about inflammatory bowel disease at 1-888-MY-GUT-PAIN or emailing us at info@crohnscolitisfoundation.org. If you have interest in getting access to great resources on diet and nutrition, including recipes that can be helpful for patients, we have great resources offered on the Foundation's Gut-Friendly Recipes website and wonderful resources available also in Nutritional Therapy for IBD's website as well at ntforibd.org. Thank you again and have a great evening.